for joining me for another episode of the Wellness Doctor Network, where we connect the community to top-notch doctors. I'm Dr. Holland Meyer with my guest, Dr. Charles Shidlofsky. Thanks for joining us today.
Pleasure to be here.
You bet. He's a neuro-optometrist, world-renowned. He speaks across the country and around the world. He specializes in developmental vision, athletes, brain injuries, specialty lenses, specialty needs, and that's just to name a few. Today we're going to talk about developmental vision. So tell us exactly what is developmental vision and what do these parents come say to you?
Well, developmental vision really is an area of optometry that's concerned with children as they develop their visual skills over time. And so that's largely what it means. So it's a very generalized term, but every child goes through a developmental process. And so what we want to do is understand how things can be affected by that developmental process. For instance, you have children who have lazy eye, or also known as amblyopia, or you have a child who has an eye turn. They have certain developmental issues that may lead to that. Then you also have children on the autism spectrum who have ADHD and ADHD, dyslexia, just general learning related vision problems that have developmental issues that go along with it. And of course, also just general binocular vision issues. One of the most common ones we see today is what we call convergence insufficiency. So what we have to do is take a developmental look at those aspects and then see how we can kind of redevelop those skills and train their skills so that they'll function at a normal level. Yeah,
so you work with all kinds of doctors and therapists, and even sometimes it's the teachers that recommend you.
Oh, absolutely.
Yeah. What are some of the complications? I know we went over some of the diagnoses that are involved, but what are some of the complications that these parents and the kids are dealing with? And then what does therapy with your team look like?
Okay, well, let's start with what we tend to see. Certainly the biggest thing we hear is oftentimes is that the child is not performing in school. Okay. So if the child's not performing in school, a teacher might refer them, or they might even get referred to potentially an occupational therapist or a physical therapist first because of their performance, or a speech pathologist.
Right.
And, they might do an evaluation and say, well, your vision skills seem to be off, or vision seems to be playing a role in your inability to learn. And so they might make a referral to us, and then we'll do an evaluation. And I think that's largely a lot of ways people get here. Sometimes they're in active occupational therapy or physical therapy, and the therapists say, oh, there's more that needs to be done. And that's where we kind of step in and take a role as far as that goes.
Right. And so whenever there's more that needs to be done, because you're more than just an optometrist, it's the neuro-optometrist as well. And so what kind of therapies, what can the patients expect for therapy when they come see you? Because I know you have just a ton of technology around here.
Right. Well, we do love technology, but I break therapy down into two parts. There's passive therapies and active therapies. And passive therapies quite often are lenses, prisms, tints, occlusions, all designed to create a therapeutic effect. They're different than a regular pair of glasses in a sense, because a regular pair of glasses will correct your vision if you're nearsighted or farsighted. But a therapeutic lens is designed to change the neurological system so that you process information more effectively and more efficiently. This can also be combined with a nearsightedness or farsightedness prescription as well for those who need it. But I would say a good 60 to 70% of our patients don't really need an eyesight correction, if you will, but they need a therapeutic correction.
Awesome.
And so we can provide that for them. And that's what we call passive therapy. Active therapy is where they actually come in and work with some of our vision therapists here in the office. And when they come work with them, they'll do all sorts of activities that would enhance their particular skill deficits. And so we're going to elevate the level of skill. So I kind of talk about therapy in really what I call the 3 R's. The first I call is rewiring. We got to rewire the brain so it processes information more effectively. The second is re-education, and that's breaking the old bad habits and developing the new good habits. And lastly is retention. We want to make this a permanent change. And the only way to make a permanent change is to change the brain.
Yes.
We're really working on changing the brain, not changing the eyes as much. Okay, we're not moving the muscles. We're not doing anything like that. We're giving the muscles better signals from the neurological system so that they can process information. more effectively, more efficiently.
That's awesome. And I love that because you're getting to the root of the problem.
Right.
So it doesn't become a long-term issue.
Exactly. And we're solving the problem for permanence.
That is incredible. I love that. And I know you have a ton of success stories, but what's one that sticks out to you most recently?
Oh, I always think of this child who was on the autism spectrum we saw, who really couldn't even walk a straight line, didn't really know where they were in space, things of that nature. And we were in the process of testing, and we put some therapeutic lenses on him, and he walked in, and he was able to walk in a straight line, and was aware where things were in space. And when we were rolling a ball to him, he was able to manipulate and catch the ball.
Wow.
So it was really just such a dramatic shift that he had. It was really kind of cool to watch.
Yeah, and that's life-changing, not only for the kiddo, but for the parents as well.
Oh, absolutely. I tell parents all the time, I said, what is your time worth? Right. You know, because we have these kids and they're spending 2 hours doing 20 minutes of homework. And all of a sudden now they have all this time they've regained back.
Right.
Because the child's able to complete their task in a normal amount of time, whether it be 20 or 30 minutes.
I would think that would even go on to the fact that the relationship between the parent and child is just a lot more cohesive too.
It's a lot less stressful.
Fighting.
And a lot of people don't even think about this, but what about the siblings?
Yeah.
Okay, because they have to give so much more attention to the sibling that's having a trouble, and then the other siblings get kind of left off.
100%.
So this really just helps that whole family unit ultimately by helping that one child.
That's awesome, the impact you're having on people, which brings me to my favorite question I love to ask the doctors I interview. What is your favorite thing about being a doctor? My favorite thing about being a doctor is watching these children and these adults go through changes that make their lives so much better, so much more efficient. And it makes coming to work every day fun. Right. I get to work and do my hobby at the same time. So how many people get to say that? So that's really, and it really drives my passion for this. I mean, I never have a bad day at work. That's awesome. And I can attest to that. The passion, the way your face and your eyes light up whenever you talk about your patients and what you do is pretty amazing. And being one that speaks around the country and the world, but also being the student at the same time and always learning is pretty impressive. Well, I think always learning is really an important part. And really part of it is the fact that I get to work with professionals in all sorts of different fields, from other optometrists and ophthalmologists, but also to physical medicine doctors, occupational therapists, physical therapists, chiropractors. So really all these different fields I get to work with, and I learn from them, and hopefully they learn from me as well. That's amazing. And thank you so much for joining us. Oh, it's a pleasure to be here. Thank you. And thank you for joining us for another episode of the Wellness Doctor Network, where we connect the community to top-notch doctors. And even within the network, we collaborate so we can bridge the healthcare gap. Thanks for joining me. I'm Dr. Holland Meyer.